Good morning, students. Today, we are going to simplify nursing pharmacology and make it less overwhelming. The goal of this session is to help you understand how drugs work, how the body processes them, and how to apply this knowledge to NClEX questions and clinical practice. Let's begin by asking ourselves a basic question. What is pharmacology? Pharmacology is the study of drugs, their effects on the body, how the body handles these drugs. As nurses, we are responsible for administering medication safely, monitoring the client's response, preventing harm, and educating the patient. Section 1. Pharmacokinetics. First concept, pharmacokinetics, which means what the body does to the drug. There are 4 major processes. I want you to remember the acronym ADME. Absorption, distribution, metabolism, excretion. Now let's walk through them. Absorption. Absorption is how the drug enters the bloodstream. Different routes have different speeds. Example: IV, fastest. IM, fast. Oral, slower. Topical, slowest. Teaching point: food can delay or block absorption for many oral drugs. This is why some medications must be taken on an empty stomach. Distribution. Distribution is how the drug travels through the body. Key factor: protein binding. If the patient has low albumin, more free drug circulates, increasing toxicity risk. Clinical application: patients with liver disease or malnutrition are at higher risk. Metabolism. Metabolism means drug breakdown. The liver is the primary organ involved. If the liver is impaired, drug metabolites accumulate. Check labs. AST, ALT. Excretion. Excretion means removal from the body. The kidneys play the major role. If the kidneys aren't functioning well, drugs build up. Check labs. BUN. Creatinine. Checkpoint for students. I want you to think for a moment. If a patient is in renal failure, how will that affect drug levels? Correct clinical reasoning. Drug levels will increase. Drug levels will increase toxicity risk. Good. That's exactly what NClEX wants. Application, not memorization. Section 2. Pharmacodynamics. Next part, pharmacodynamics, what the drug does to the body. This includes mechanism of action, therapeutic effects, side effects, adverse reactions. For NClEX, knowing drug classes is more important than knowing individual brand names. Example: beta blockers end in LOL. ACE inhibitors end in PRIL. ARBs end in sartan. Section 3. Priority Drug Classes, NClEX. Let's start with cardiac medications, because NClEX loves cardiac drugs. A. Beta blockers, e.g. metoprolol, atenolol. Teaching points. They reduce heart rate and blood pressure. Monitor BP and HR before administration. Important. Hold if HR less than 60 BPM. Side effects. Bradycardia. Hypotension. Fatigue. Contraindication. Asthma can cause bronchoconstriction. B. ACE inhibitors, e.g. lisinopril. Teaching mnemonic. ACE equals angioedema, cough, elevated potassium. This cough is dry and persistent, and it does not go away. Patients often discontinue because of the cough. If ACE inhibitors cause problems, the patient may be switched to an ARB. C. Diuretics, e.g. furosemide. Loop diuretics cause hypokalemia. Whenever potassium is low, one drug becomes very dangerous, digoxin, because it can cause toxicity. Question: what electrolyte must we check before giving furosemide? Correct answer: potassium, K+. Section 4. Medication Safety. Nurses must know the 6 rights of medication administration. Right patient. Right drug. Right dose. Right route. Right time. Right documentation. These are tested constantly on NClEX. Pause point. Before we move forward, tell me which direction you want the rest of the lecture to go. Reply with one of these options. A. Continue with antibiotics, endocrine, neuro, psych, anticoagulants. B. Include NClEX practice questions with rationales. C. Add patient education, plus nutrition, plus contraindications. D. Add real case scenarios, clinical reasoning. E. Give full teaching package with all of the above. Just reply, for example. Option E. And I will continue in the same teaching delivery style. Thanks for watching, and don't forget to share the video with friends and subscribe my channel